Hey, I'm Sunny. I'll be your student nurse today.
Hello.
So you're here for a physical assessment?
Yes.
All right. So first of all, can you give me your first and last name and your date of birth?
It's Lauren Pierce, 11/01/2000.
All right, great. All right, and can you tell me the date today?
It's September 15th, 2022.
Okay, and the president?
Joe Biden.
All right, and are you allergic to anything?
No.
Do you have any pain today?
No.
Okay, so I can tell by all of that you are alert and oriented times 3. I'm also going to I also noticed that when you were walking in that your posture was erect and then your gait was steady. So now we're going to go ahead and start with the physical assessment. So I'm going to start off by looking at your head and your face. You can see that your head is normal cephalic, that your hair is also nice and kept and well groomed. So I'm going to check your face real quick. Do you mind if I touch you?
Sure.
Alright, so your skin is nice and warm and smooth. There's no lesions, bruises, any edema anywhere like that. Your skin color is also appropriate for your ethnicity. So now I'm going to go ahead and check your eyes. So I'm going to look at your conjunctiva, which is nice and pink and moist, which is good. Your sclera is also white and clear, and your corneas are clear. So now I'm going to check perla. So just look at me for a second. I'm going to shine a bright light. Alright, good. So now if you could just follow this pin in on it. Follow back out and then side to side. Alright, so I can see that perla is intact and that your pupils are equally round and they're reactive to light and they also accommodate as well, so that's normal. So now I'm going to first check with your nose, so if you could look up for me. Alright, your nostrils look equally symmetrical. There's no deviation, there's no drainage, no redness, anything like that. So if you could close one nostril for me and breathe in. Alright, good. And the other side. Good. Alright, so I can see that your nares are also patent, which is normal. So now I'm going to check your ears. Do you have any pain or tenderness there?
No.
Alright, what about there?
No.
Good. So I can see that you don't have any drainage, any lesions, redness, anything like that on either ear. And I can also tell that they are symmetric with your face and they're equal bilaterally as well. So now I'm going to move on to your mouth. So if you could open your mouth for me. Say ah.
Ah.
Alright, so your uvula is in midline, your oral mucosa is nice and pink, and your teeth are also intact with your mouth as well, which is good. So now we're going to move on down to your neck. I can see by looking at you sitting up that you don't have any JVD, which is normal. I'm going to go ahead and make sure that your trachea is in midline, which it is, and then I'm going to go ahead and palpate each of your carotid arteries one at a time. Alright, so your carotid arteries were regular and I'll give them a +2, and I can also see by looking at your neck that it's in uniform with your face. Skin color is appropriate for your ethnicity. There's no lesions, scars, any edema, anything like that. So now I'm going to assess for carotid bruit. And I'm going to make sure I do that with the bell of my stethoscope. If you could take a deep breath and hold it for me. Alright, relax and do it once more time on the other side. Alright, there's no bruit noted, which is normal. Alright, so we're now going to move on down to your chest, and for privacy reasons we're going to keep on her shirt today, but we would usually take her shirt off and get a more appropriate sound for her heart and lungs. But I can see here that her skin is in uniform color with the rest of her body, and it's also warm, and there's no skin lesions, no bruises, anything like that, or edema. So now we're going to start off with listening to the heart sounds. There's 5 different spots on your body that we would listen to the heart sounds. First of all, we're going to start with the second intercostal space, right sternal border, and that's going to be your aortic pulse, or your aortic heart rate. And then your pulmonic, which is going to be your left sternal border, second intercostal space. We're going to go on down to your third intercostal space, left sternal border, that's going to be your Erb's point. And then we're going to go down to the fourth intercostal space, left sternal border, and that's going to be your tricuspid. We're going to come down to your mitral, which is going to be your fifth intercostal space, mid-clavicular line. That's where I'm also going to assess your apical pulse for a full minute. I'm going to make sure I do that with the diaphragm side of my stethoscope. And you can just breathe normal for me. I'm going to assess this for a full minute. your apical pulse was 79 beats per minute, which is in the normal range. I also noted that when I was listening to your heart, I could hear the S1 and S2 sounds clearly. There was no sign of clicks, gallops, murmurs, anything like that, which is normal. So now we're going to move on down to your lungs. I'm going to listen to a few points in the front, and then I'm going to listen to a few points in the back. So if you want to just breathe deep every time I move the stethoscope, making sure it's on the diaphragm side. And also we would normally have her shirt off for lung sounds as well, but we're not going to today due to privacy reasons. All right, good. So the front of your lungs sounded clear. There was no signs of adventitious sounds such as crackles, wheezes, or rubs or anything like that. So you can go ahead and stand up for me. I'm going to listen to the back of it. And again, just breathe deep. And with the back of her, we would again have her shirt off, and I would be sure to assess for her skin, make sure that her skin's intact. Her skin is also in uniform color with the rest of her body. There's no lesions, bruises, scars, or edema anywhere. But again, for privacy reasons, we're leaving her shirt on. All right. All right, good. So again, your lung sounds in the back were also clear. No signs of crackles, wheezes, rubs, anything like that, which is good. So now we're going to move on down to your abdomen. So if you don't mind laying down for me. All right, so looking at your abdomen, I can see that it's not distended, that it's symmetric with your body, and that the skin is also in uniform color with the rest of your body. There's no scars, lesions, bruises, anything like that. You can also see that it is warm to the touch. All right, so before I do your bowel sounds, I'm going to listen for a aortic bruit. So just breathe normal for me. I'm just going to make sure that I'm on the bell side of my stethoscope. All right, good. There's no brewery noted. So now I'm going to go ahead and listen for the 4 bowel sounds in the 4 different quadrants. All right, so you had active bowel sounds in each of the 4 quadrants, which is normal. All right, so now I'm going to go ahead and move on down to your legs. I'm going to pull your pants up just a little bit. All right, so by looking at your legs, I can see that there's no edema, no bruises or scars or lesions, anything like that. It's also the same color as the rest of your body, which is good. It's warm to the touch as well. So along with your feet. So now I'm going to go ahead and test for capillary refill. All right, good. Capillary refill was less than 3 seconds, which is normal. And also we would do the clonus test, but today we're not going to do that. But if we were to, I would go ahead and put resistance against your foot, pushing it up towards your knee, and I would let it relax on its own. And if it were to shake going back down, then it would be a positive clonus test, and we would have to go document that and notify the healthcare provider immediately. But we aren't going to do that today. So we're going to go ahead and have you sit back up for me. All right. Okay, so we're going to go ahead and assess your range of motion. So if you want to do arms out for me, arms this way, bend them for me. Okay, and then wrist down to the floor. Good. Okay, and then for your neck as well, you're going to go ahead and look up and look down, side to side. All right, good. So I can see that your upper extremities and your neck and head have full range of motion. I would give it a +3 because there was no resistance added to that. So now I'm going to go ahead and check your pulses all together. So I'm going to start with your brachial. All right, so your brachial pulses are regular, so I'll give them a +2 bilaterally. I'm gonna go ahead and move down to your radial. All right, your radial pulse is also +2, and I would give it, it would be regular bilaterally as well. I'm gonna go ahead and move down to the posterior tibial. Okay, that's also gonna be regular and +2 bilaterally, and then I'm gonna do the dorsalis pedis. Okay, and those are also regular +2 bilaterally, which is good. So now if you don't mind standing up for me, I'm gonna go ahead and test the lower extremity range of motion. Stick your leg out, other side for me, then bend your knee, other side. And then for your feet, touch the floor, back up again, same thing. All right, good. So your lower extremity range of motion is intact, and I would give it a +3 as well with no resistance added. So if you want to sit back down for me, I'm going to go ahead and test your patellar reflex. Just relax for me. All right. Good. All right, so your patellar reflex is the +3, which is normal. If anything was higher than that, then we would definitely go document that immediately and notify the healthcare provider. So now I'm going to test your sensation. So if you want to stand up for me again and close your eyes and just tell me which arm or leg that I'm touching.
Left arm.
All right.
Right leg.
All right, good. So I can see that your sensation is intact with all extremities of your body, which is normal. So now I'm going to go ahead and go document this in HIPAA in the computer and be sure that HIPAA is maintained. I'm going to make sure that you are comfortable in your bed and that your bed is lowered, locked, and both of your side rails are up ×2. Then I'm going to make sure that your call light is in reach as well. Do you have any questions for me?
No.
Awesome. Have a great day.